we have really made a lot of progress. And as we talked about in January, when we did the State of the Mailman Center, you can really see, and I'm not going to go back and repeat all of that today, but you can see a lot of the things that we've done. Our trainees, over 100 a year, that are coming through our LEND programs, our disciplinary programs, reaching out to more than 8,000 community people who are receiving training and participating in our continuing education, our general training, parents, and the like. Our leadership pipelines have continued to thrive. We've seen programs develop. One of the concerns that was, I think, really a big issue for us in March and April of 2020 was, were we going to have our jobs? Will we have our contracts? Would we be able to continue our work? And, it's really exciting to see that since 2020 until now, the funding for our various contracts and grants that have helped us do the work has gone from around $24 million a year to over $45 million a year. And the great thing about that is in other sectors of our community, many have seen those kinds of big increases, but they were tied to the ARPA funding that came out of the federal government, and that ended this year. And so there are a lot of folks scrambling to try to figure out what to do because that federal dollars for the pandemic funding went away. And our funding is not pandemic related. It is really helping us to be able to move forward in some really important ways and help us to accomplish the things that we've been doing. Our clinical services have really utilized telehealth, and we've been able to be a line leader in our community and helping other people use the virtual world to be able to reach out and help to meet services. And we've been innovative in developing new ways to do assessments, to be able to do home visits, to be able to provide therapy. And we're looking at every day at new technology uses to increase access to children through the work that we're doing. And so when we look at our 4 years, we've come a long way. And we really are now at a point where I think I've had 6 vaccinations. I'm not sure if there'll be another one this year, but we're not doing vaccinations as much as we used to anymore. And we're back to the new normal, and it is a new normal. What we wanted to do today was to not spend a lot of time talking and going through detailed PowerPoint slides, but to give us an opportunity to share with you some things about where we are, where we're going, and then briefly give everyone a chance to come in and in an open comments and ideas section. So first thing we'll do is do a little bit of reflection on our 50th anniversary celebration back in September, which was amazing. We'll talk a little bit about continuing our mission and a conceptual piece I've shared in a couple of places, but I think I wanted to share it with our whole Mailman Center family today. To take a quick look at where we are with the development of our strategic plan and our strategic priorities, and then to have a good discussion about the important role of maintaining and strengthening belongingness here at the center, and then open comments and the like at the end. So as you go along, if you're online and you want to drop something in the chat, Jason's going to be monitoring that as we go along, and here in the room, jump up and down and chime in. Just real quickly, we had a wonderful celebration in September. And if you didn't get to be there for it, or you want to go back and see it again, go to our Mailman Center website. It's right there on the front page. All of the sessions were recorded and archived, and you can go back and relive. But it really was a wonderful 50 years, and we've heard from a number of people. We had, I think, close to 600 people who joined us for that event here and in person. And it's a great way of recognizing our history, but also helping us to look forward. And that's what I'd like to share for just a minute, is this whole concept of how do we move forward? What's next part of things? there's a model that has been shared broadly across the country called the two-loop theory of change. And it has the idea that you have a system, a program, and it grows, and then it hits a peak, and then it begins to decline, and it ultimately expires. And somewhere around the time of that peak, whether it's because people get disappointed, disoriented, they get new ideas, a new program starts with experimentation, and it goes through a period of time. And then when the old finally expires, the new comes in and takes its place. And so it's a replacement system. And if we look at where we would be with the Mailman Center, we're kind of at that high point. And so if we follow this model completely, we are on a downward trend to destruction until something else replaces us. And I didn't think that was such a great idea. So we came up with a modified or expanded theory of change. And that is, we take that established system, the typical train of life, and we change it. Instead of declining, we use our time here at the high point to not have a disruptive system, not to have an expiration, but to really have an emerging system that we intentionally power into the future. What that means for us is that we've got to have new ideas, and we've got to be on the front end of everything. But we also have to think about what are the things that we're doing now that would have died in that downward period. And they're really good, but we don't necessarily have to own them all anymore. And how do we distribute those out to other use sets, to other community partners and agencies, and have them pick them up and go with them, and disseminate those best practices so we can get on with the important part of coming up with the new ones. And so we're really at that point of being at a high point and trying to think about what are we going to intentionally create as our next emerging system, and what do we have to let go, and what are we going to replace it with? And it's an exciting and really dynamic time for us. And that really comes into our strategic planning process, which we started last summer, I think, or actually about this time last year. And we've been going through a lot of processing, and have really identified 3 priority areas. Really expanding the health equity and our work, not only in awareness, but in practice. Being able to think about community-based principles for research and how we apply those to our training, to our clinical services, to our engagement. And then also to think about innovations in technology, but with a focus on innovation and technology being to drive us to use technology to increase access and improve outcomes of the work that we're doing. So I'm going to turn it over to Jason for just a minute. He's been working with the groups, and he can let you know what is happening with our strategic planning process.
Howdy, everybody, online and here. So we've been working through a lot of this over the past year through a lot of great feedback from faculty. Apparently I'm too tall. I was trying to stand back, so it was like, I'll just do this. So that we have this opportunity to really, from the very beginning, co-design each of these things. It had been about 10 years since our last strategic planning. We thought with COVID and kind of all the advancements, it was time to kind of go back to where we needed to consider going next. So we had initial planning, a retreat where we had a lot of Mailman faculty, kind of like lead program staff. We had community partners show up and present some initial ideas. And then we moved on to bringing all of those ideas back for additional feedback from the interprofessional collaboratives that we have here at the Mailman. Then even some of the program leads brought those ideas back to the team. After we went through that process, we summed everything up and tried to collate into specific themes. We went to our community partners again, like, hey, does this resonate with what you're thinking as well? We took it back to everybody one more time just to make sure that we're there, to really just make sure that we're kind of getting at the key elements of what Mailman staff faculty, trainees, and our community partners wanted to do. So that's where we got into this idea of health equity, CBP, and innovation and technology. And one of the big drivers of trying to move forward with this is each of these things can be a bit ambiguous if you don't define them in an operational way. And when we talk about CBP principles, there's this construct of shared language. So even if we think that we're talking about the same thing, if we don't take the time to truly define that together from the very beginning, then we could have mismeasurement and not even know if we're moving in the right direction in any of these initiatives. So there's 3 different work groups that have been working over the past 5 to 6 months just to begin to kind of outline the process. And there's been a healthy tension of trying to figure this out, but also trying to figure out how to move it forward in a way that honors each of the other strategic aims, right? So health equity, they need to be considering community-based participatory principles within everything they're doing. And like, in what ways will we be able to utilize technology to bring forth that health equity? In the same way, technology, we know with software design, there can be all kinds of bias that's built into it. When we think about human-centered design, are we thinking about people who may have differing experiences with technology, and how can we make sure that we're designing new technology or utilizing new technology or disseminating new technology that honors kind of the community that we serve here? So we're kind of at that point now where we're seeing lots of healthy overlap between the initiatives, but I think where we're trying to go next is to really reflect on kind of where we're at with each of these things. So Mailman Center and our community partners, we already have lots of great things that we're doing in the areas of health equity. We're doing a fair amount of community partnership. I'm not sure it's always community-based participatory where it's co-designed from the very beginning. And we also have lots of our programs that are being innovative with technology, but with things like AI, things move so fast with technology that if we were to say in our work group, like, hey, we're going to focus on technology B, by the time we get done with like the work plan, that technology could be obsolete. So the groups came together yesterday, and I think where we kind of think one of the next steps and where we want your input is we really need to get a baseline survey of where are we at with some of these things. And people are like, I don't want to do one more survey. But again, if it's a strategic plan for the center, we want it to be something that represents everyone here and also represents our community partners and what they want to get out of this. So some of our work group co-leads are going to be working on a short, like 10 to 15-minute survey that we'll be asking for Mailman faculty, staff, and trainees and our community partners to complete to help kind of drive where are we now, so it gives us a picture of where we need to go next. With that, I will turn it back to Dan.
Thanks, Jason. I'm probably going to have to bring it down a little bit because I am not that tall. Is that good?
Yeah, a little bit.
A little bit lower?
Higher.
A little bit higher. Okay. One of these days, we're going to figure out how to do the technology from the platform here. That's one of the things that we're working on. Our vision statement is to improve lives through innovation, impact, and connection. And those are the kinds of things that are actually embedded in these strategic principles and our priorities as we move forward. But I want to share some thoughts about where we can go, because it's important for us to expand our minds a lot. When we think about technology, there is an issue for us in the area of access, and it's a huge one. I'll use mental and behavioral health as just one example, but it applies to many of the areas that we cover for children with developmental and intellectual and developmental disabilities. If we take all of the licensed doctoral level and master's level providers in the area of child behavioral and mental health, psychiatry, psychology, developmental behavioral pediatricians, advanced practice nurses, social work, and we take all the children who meet a diagnostic the diagnostic criteria for a behavioral and mental health disorder. The caseload right now is about one provider for 1,100 children. Now, that doesn't take into account anything we do in terms of prevention. That's unmanageable. Now, I know we all have a history of training as clinicians to do one-on-one therapy or to work with parents or to do small groups. But if we do that and we continue to do that, each provider can probably only see 120, 130 cases a year for multiple sessions under current models. So we are leaving over 800 children who have a mental or behavioral health challenge with no access to services under our current model. And so when we talk about our whole approach to use of technology, that technology is not for technology's sake. It is to be able to address an acute access and care need. And so when we think about that, we've really got to be stepping out of our history because it's not working. And one of the solutions that comes up often is to say, well, let's just train more. To train one more doctoral psychologist or psychiatrist is a 10 to 15-year process. We'll see them in 15 years. That doesn't work. So our technology is important. We're having some conversations with large private corporations right now to bring concepts that we have to the table so that in a partnership type relationship, so that we can move in ways that we've never considered before. Can you imagine, for those of you who are on Zoom today, that instead of looking at the Hollywood Squares box, that we had a conference table and each of us was a moving avatar like in a video game. And then when we got together, we had our own voices and we moved around and we saw the movement and we interacted like we would in a real room instead of in boxes. That's a simple thing for organizational. But what if we could take that technology and AI and we have an individual, a child or an adult with a communication disorder who's reliant on a piece of today of really advanced augmentative communication devices where they are able to type on a keyboard, and then after they finish typing, we have a delay and the Stephen Hawking computer generated voice comes out and everyone listens and asks questions and then they go back and type. Instead of that we're able to use AI so that each individual with that communication disorder would be able to develop their own voice with their own emotional inflection. And that through the use of AI, that we could actually generate conversation in real time in a fluent fashion, probably more satisfying for everybody in the room, and certainly engaging in greater independence. Those are two ideas of what is possible in the future. And I really wanted to put that out. And we do that with our partners in the community from the very beginning, so that we're not just doing it here in this center that's been here for 50 years, but we're doing it in Overtown, in East Little Havana, in Richmond Heights, in Homestead, in Ocala, and perhaps through the work that we do, we can have that impact in Central and South America as well. These are the exciting opportunities for us as we look to the future. And so wanted to take a few minutes to just kind of cover that. The next agenda item for us is really one that I hope we can have some discussion, input about, and it is a starting point. And that is assuring that being a member of the Mailman Center is more than a job. How can we enhance and sustain belongingness? When COVID hit, I think we had the greatest sense of belongingness here that we really ever had. Everybody was on board. And during the years, we've made adaptation to being able to use virtual communication to do therapy, to do our meetings, to carry out our projects. And from a productivity perspective, we are doing exceptionally well. But today, as a town hall, we have about 15 people present in the room and a lot of people on Zoom. When I come into the office now and walk down the halls, one of the things I used to like to do was just to drop in on one of the assistants working in one of the rooms and to say, you know, how are you doing? Tell me a little bit about what you're working on, and thank you for being able to contribute to what we do at the Mailman Center. Well, I don't do that anymore because there's nobody sitting in their offices to be able to jump in on. And there's no easy way for me to drop in on Zoom. And I worry a little bit that if I send somebody a request to have a meeting with me on Zoom, they all freak out going, what's the director want to talk to me about? And that kind of takes away the importance of belongingness and the real informality of an important process. We are working incredibly well on our projects. I mean, look at what we've done in terms of increasing our funded contracts. That's really unmet in our history and in a lot of other histories. And those programs are really doing great things. But I question sometimes whether we're missing the opportunities not for the senior leaders. I think our senior leaders do a good job. The folks in the steering committees, program directors, faculty are involved. They know one another, relationships are established, and they're working well together. But I worry a little bit about how are we getting the interconnectedness, the belongingness for our trainees and our staff to be able to see what's going on with other programs across the way. From an interprofessional training component with our LEND program, I worry a little bit that we run the risk of siloing again into disciplines, because we have training programs for each of our groups. But what are the opportunities that we have intentionally so that our social work, our audiology, our physical therapy, our occupational therapy, our special education, psychology, and our pediatric residents have an opportunity to actually meet together and work together? And we're doing a lot of that, but we have a risk of losing it. And I want to put that onto the table. Now, please don't immediately start freaking out saying, Dr. Armstrong wants us all to come back to work every day. No, I recognize the real benefits to the work-life balance that we have. Quite honestly, it's really nice. I try to come in probably 3 or 4 days a week, but it's really nice to not have to make that trip in traffic every day. And now, since things are virtual, my travel in and out is usually I'm in a meeting. I schedule my trips on the train to go back and forth when there's a webinar or a meeting where I don't have to run it, but I need to be in it. And I use that time for travel to actually do the work. And it's very helpful. And there are a lot of things that we've gained from our virtual world. But what I wanted to raise today is to get thoughts on, are we doing okay? Where do you see as danger points for us? And are there ideas and creative suggestions of how to maintain our belongingness and connectedness? Because I quite honestly don't want the Mailman Center to become a large multinational corporation with $1 billion budget and people don't know who they are, and they're always looking to see, well, okay, this is a job, I want to jump to the next job. The thing that has made Mailman Center successful and meaningful has been those meaningful relationships, and the fact that we all belong to something that is much bigger than we are. And we are accomplishing things that are much bigger than we are. And so it is crucial for us to pay attention to that belongingness. So let me stop for just a minute and open that up for some discussion. Am I off base? On base? And if so, what strategies, suggestions do folks have for what we can or should do? Oh, we can be recorded, yeah. Bob.
Back when Moses was a child, not very around. Mailman Center in general was like a very large family. And what made what made it that way is because everyone looked up at everyone else, everyone supported everyone else, everyone knew who the other person was. And then there came a time that a lot of that disappeared for a period of time. And then what I have done for my section is work hard to keep my hallway very family-like, because we are with each other as much as we are with our whole family. And it's important that we are together, we talk to each other. With the advent of Zoom and the other Microsoft program, Teams, I can never remember. We've lost some of that for convenience sake. And there is a difference. Let's take the IDES meetings, for example. We do that virtually now, 100%. We used to come together in a conference room and have discussion as we were around a large table. The trainees appreciated that and got a lot from that simply because in addition to each person reporting the child results, there was interaction on the side, discussions on the side that really helped to clarify and lay a foundation of understanding for the trainees and individuals in different disciplines. We've lost that, and I do miss it because it was a much, much richer experience being all together. Now, in saying this, I am not saying we need to all come back to the office, but there are certain things that are important where we can really work together and get to know each other and lay that foundation for collegiality. And that's simply one example of what can be. And so I would like to encourage that concept, at least on a limited basis, for the meetings that are very important, that do involve trainees, but allows us to come together and really continue to get to know each other in a way that we support one another once again.
Okay, thank you, Bob. We got the message that unfortunately the mic is not translating well to Zoom. So I'll summarize Bob's comments, which was in the past, we had real opportunities for people to not only share what they were sharing, but also be able to have side comments, that there were relationships that developed up and down the hallways as family got put together. And that in the process of going to virtual, while efficient, we've lost some of that connectedness. And Bob's suggestion is we look at ways to be able to come together in real time, maybe not every day, but to come together periodically so that we are able to build those relationships and reestablish those really close connections that make things work well together. Reasonable summary, Bob?
Yes.
Okay, good. Anyone else have anything in the chat?
From Alana.
Sure.
So me saying it and then you saying that again.
All right, for Milana, she says, for me, having the option to attend virtually has made me feel a greater sense of belonging because I'm able to be part of so much more that I would miss if I had to walk across campus. For my staff who are in the field, they attend more meetings because they can. Also, we allow time during meetings for small talk and sharing personal updates and icebreakers. Yeah, it's an excellent point because I think one of the things we have seen is that attendance at our grand rounds, our meetings, and things that we've done, it's never been higher. The flexibility that it has provided for us has been really superb. And I am writing a paper right now. One of the arguments that I'm making is that the virtual technology is probably I won't even say probably, it is the greatest step forward for inclusion for people with developmental disabilities and all disabilities since the invention of the wheelchair, because it allows folks who would face all kinds of transportation, physical barriers, communication barriers to be able to fully participate. And that is a really important point. Alana, thank you for for pointing out that strength of where we are and what you're doing with your team. Let's see if we got any other comments.
Well, I'll just comment real quickly. It's Alan Delamater.
Hey, Alan?
Yeah. I mean, certainly the virtual world increased our ability to connect during COVID. But then after like a year or two, when we started talking about, having options for maybe working at home entirely, or there were questions about, well, maybe you could be half and half and hybrid. And, I worried at that time that we would lose this connectivity, this belongingness sense. I don't think we've lost it entirely at all. But I do think we need to every now and then get together in person, because it's just no substitute for in-person connectivity. I mean, just coming from a conference last week, for example, all in person now, and it's great to connect with colleagues who you haven't seen for a while. But where you work on a daily basis, it's great to have a better sense of who are the people in our group, because I find myself not meeting the people I used to meet all the time, not knowing them as well. So I think, therefore, we're not going to let go. It's a hybrid world for sure. And I think some of the faculty, some people just are happy to just keep it that way entirely. But I do think we need to go out of our way to promote and design and schedule in-person meetings more frequently than we currently have. So that's something I think we can do it on a program by program basis, because we do work in small groups, aside from big meetings like this. But I do think it would be, and every now and then in psychology, we get together and we have some in-person meetings, and everybody always says the same thing. Oh, it's great to see everybody, and it is. So I think we should do it more. It just gives us, it helps to enhance the belongingness, and that's what we want. We want to sustain that.
Good.
But in the community, it's in the chat right now. Yes, it is certainly a way to stay connected. And that's the real benefit. And then, given everybody's busy lives, being able to stay at home and not deal with 2 hours of traffic. That's one of the reasons we're as efficient or more efficient. I think,
Yeah, in so many ways. I see the note from the notes coming in. Lizzie's point is a really good one, because the virtual component allows us to do what we put into our vision statement, which is connection. And our move to community participatory as a strategic thing means we have to be outside this building. Over half of our programs now are located in the community, which is a great thing. But it takes longer to get from Homestead to here than it does to go from Rhode Island to Pennsylvania. It really is sort of an amazing issue of the geographics. And so in that respect, I think we have had some real positives. And so I guess and I really appreciate everyone jumping in, talking about the benefits of our virtual world. And I think we have that. The question is, are there some things we need to do intentionally to supplement, complement, or change the way that we do that to ensure that we have the connectivity? Because what I'm not sure about, and tell me if I'm wrong, is that I'm not sure that we're necessarily getting the cross connections with programs that are not our own. And so I talked a minute ago about my concern for the trainees not necessarily being able to interact with trainees from other disciplines in an interdisciplinary thing when their service component is on Zoom all the time. I worry a little bit too that maybe we're not getting the kind of interdisciplinary connection between the faculty and the trainees. So I wonder how many times now outside of IDES do our audiology faculty get to interact with the pediatric residents or the physical therapy trainees? And that's an important part of where we are, is figuring out how we do that. That the staff at Jumpstart, who really excitingly got named Program of the Year, get to interact with the folks who are working in the diabetes clinic. And so really thinking about intentionally, not that what we're doing is bad, but to have us think a little bit about what can we do to make sure that we don't lose that connectivity, and just by the amount of work and time that we have to do, that we fall into silos again, because we really came out of silos. Now we've moved early steps back into the building. We're in the middle of moving child protection team into the Christie House. So they're there with the state attorney's office and with the sexual violence, sexual trafficking programs. So there's some cohesion that's being developed and people are moving around. But I really wanted to take a little bit of time today for us to think about and make sure that we intentionally don't lose belongingness because we just got caught up into, some other frame. Anyone else have any comments? We've been looking at chats that are coming in, and there's chats there from Julieta and Christina and Austin, but I forgot, Alan, you showed us you can talk even in a big room. Oh, hi Shelley, I can't see you.
Oh, you have mic, okay. I agree,
Get very close to it so it's loud. So we can.
I agree, I just wanted to be mindful, this is such an individual thing. And I do kind of feel the other way, I feel like a less sense of belonging because of Zoom and the virtual world. Personally, I gain energy and creativity from interacting with others in person, because it's very hard to have that connection virtually, sharing a screen for 5 hours a day. That's just me. And that's why I often come to the office almost every day, because I miss that sense of family, that sense of connection. I used to love seeing Jeff on every day, and Michelle every day, and like vibing with them and gaining their ear for feedback on the leadership programs that we run. So I just want you all to be mindful that it's a very individual thing, and consider burnout, because it's very stressful, the work that we do, and being on Zoom for all day, that's tiring. So I want y'all to think about the mental health component of the virtual world as well. Let's not forget that for our staff and our employees and our faculty.
And you're right, Shelley. I think that is an important thing. For everybody, it's sort of an individual thing. And it's not even just an individual thing. And I recognize this very clearly. It's, we are all here in our jobs, but we're also parents and sisters and caregivers for aging parents and grandparents, and we're all doing many different things in our life, and our being able to figure out a model that works for each of us, that helps us to really be committed to the mission of the center and the work that we do, but to also make sure we can keep up with the rest of our lives. And some people actually are really fine being 8 hours on screen, and others can't stand it for more than an hour. So recognizing those individual differences, I really don't want to, I think we've got a model that works. I raised this issue though for us to make sure that we're intentional in whatever we do, in not losing that connectivity that we have with one another. And whether you come into work every day or you work remotely all the time, for us to find ways to make sure that we get people connected. And I see some folks popping up saying, I'm a new hire and I haven't been in yet. And that's sad for me, because then I haven't met them yet. And we don't have a way to just kind of drop in and meet each other on Zoom. So if we're going to use the Zoom platform, maybe we need to think a little bit about how do we have Zoom meetings just for the purpose of talking to each other.
Well, I was going to say that we do on Families First, we allow time every meeting at like a half hour, not just like 5 or 10 minutes or whatever. And then people stay on after. And sometimes they even go into breakout rooms to chit chat with each other. Like, we have it set up that it's not just staff meeting. It's kind of a social staff meeting. And I think it's worked really good, you know, for our team. And so I think when you have a meeting, kind of setting aside time to check in with people, to kind of see how they're doing on a personal basis before, you know, you go into the nitty-gritty of things can really be helpful in your team staying connected and in staying connected with them. And we do have retreats and things outside of work where we go for lunch. So we do incorporate some of those things as well, where it's not just all work. There's a social piece, because I do see value in doing that, like Alan was saying, you know, at times.
Well, I'm wondering, Alana, I just had a thought, and I'll put this out for folks to think about that. And Evan, you've got a Mailman-wide interdisciplinary community of practice meeting would be wonderful. Kind of along those lines, if you're having social, you're having that social time within your programs, what about the thought of putting together people from multiple programs into a virtual social hour? So we have we bring folks from early steps in CPT and the HEMONC program and IDES, and we bring trainees and staff from those programs. We do an invite and we say, we're going to have this meeting. We bring everybody in to get to know each other in a smaller group, enough to where we can have some conversations. And we start to create some intentional social opportunities across programs using the virtual platform. Is that something that would make sense?
I love it personally. And Families First would like to be included in that, because they really know no one before COVID, after COVID, during COVID. So they would love to be more connected to the other disciplines as well. So I'm sure that our staff would want to participate.
Yeah, Russ.
I was thinking that besides Zoom, it's just so rigid, has to be scheduled and all this, but another platform that's more like the open door policy that we lose since we are no longer in person is Teams. I've done that with colleagues where you're working on a project and you have some immediate discussion you need to have about it. You just, you know, call them and you have a video conference. It's one-on-one. And there's a sense of belonging and all this. I found that very helpful. So intentionally using Teams more often.
Good. And Ray made the same comment in the chat. Now, for some reason, my computer does not like Teams. So I go into Teams and it's a 15-minute process to be able to connect with someone. But that's a technology problem. But any kind of solutions we can have. I mean, not really solutions, because I'm not sure that we have a problem yet. It's sort of like that two-system changed model I had. It's really better to come up with the solutions when everything's going well than before everything starts to tank. And that was the reason for our conversation today. All right. Any other comments on this topic?
I'll just add real quick is that something that happened, I don't know, something that happened pre-COVID was people would just have their doors open. So that it made it easy to drop in when they're actually in the office. Now, I think during COVID, people were like, we were told that we had to keep doors shut. And then I don't think the doors ever opened back up. And now people come into the office for now having Zoom meetings, and now they're closing their door for privacy purposes, which also defeats the purpose of just like dropping into somebody's office. So
Yeah, there are a lot of sort of naturally evolving barriers that we have to figure out how we work out, and so that's good. All right, so I wanted to leave a couple of minutes here to just open this up for any other questions, discussion points, ideas of things that you think can help us really achieve our mission and be happy doing it. So from anyone, anything to say? And you don't need a soapbox. All right, I'm really worried about us because this is not the Mailman Center faculty and staff have never been somebody who didn't have something to say. So,
Well, I got something to say then.
Me
I'll
too,
chip
me
in.
too,
Good,
after
Alan.
you, Alan, after
I'll
you,
chip in.
Alan.
I think, when I was thinking about today, I thought, well, what are the things that we got going that are really working well? And there's a long list actually. And, and certainly among them is our connections with our community partners. I mean, we've really grown tremendously in the last 10 years or more. But the other thing that is really working well is our training programs. That's always been, I think, a jewel in the crown of the Mailman Center in a lot of ways. And and I've seen our training program expand in the last few years, especially. I'm thinking about Team Coach. I'm going to call out Nellie and Jason and Team Coach, because that's taken and Ilana as well. That's taken the training and bringing it out into the community. So I want to say that I think we can even go bigger. And I'd love to see us increase our reach so that the Mailman Center can really be more national in delivery of continuing professional education for CE credits, for CME credits, which will also be a benefit to the center because we're going to be generating some revenue by doing that as well. So I mean, I know we've been talking about this for a lot of times over the last few years about how we can get the platform working and how we can make sure that people can pay on it and there've been a lot of technical barriers, but let's make that a priority. Let's expand the reach. We've got a lot of things, I think, trainings that are in the can, so to speak, and that could be just put out there to not only disseminate best practices, but also to generate some revenue, because we do need more funding for, a lot of the things that we'd like to be doing.
good point. Other
Well,
ideas?
What I wanted to say, is very rewarding for me to hear that everybody's grappling with the same things that I'm grappling with. How to be creative and get the best of both worlds, and create to me, it's like still working on finding the hybrid model that works best for the social work, for pediatric social work. And I'm loving this discussion. I want to thank you, Danny, for giving us the space to discuss together these issues, because this is exactly what creates the belonging and the connectedness that we need. So we should have more of these. Maybe it's different size, different formats, in person, and more of these. Like keep it up with these meetings that are precisely purposefully called for creating that belongingness and connectedness, because I think that's what fuels us, really, our work.
Thank you, Julieta. So that's a great idea, and as we go along, email ideas of what would you like to see in a town hall, what would be a good topic to focus on, and we can advertise and put these things together for our entire Mailman family or for selected individuals who really want to come in and jump in on a given topic. I really appreciate that feedback. Great idea. Other thoughts, ideas? Things that we need to do. Right now, the elevators are working. That's always been a question. We're going well there. The bathroom renovations are going. We do still have a lot of things to do in the center for really increasing our accommodations. We've got, we've renovated some bathrooms, we've converted some bathrooms, and we will be replacing all of the audiology booths here in the center. I think that the ones that we have were put in slightly before Moses was a baby. We're replacing that and really updating that. One of our big initiatives that we planned on, and thank goodness we started planning on it a long time before, was to really integrate with our colleagues in ENT, in the audiology and children's hearing program, to really expand our reach. And it was a really good thing that we started that, because I think everyone knows Bob Pfeiffer has decided to retire at the end of this month, which is a huge loss for all of us, Bob. Bob has brought clinical knowledge that has been phenomenal, neuroscience knowledge that has been phenomenal, an outstanding teacher and a great colleague. You're not being here. Everybody's already talking about how they miss you, even though you're still here. But we do see really great opportunities to develop collegial relationships with our colleagues in the children's hearing program and expand the access in that area. We have an opportunity, and we'll like to really jump onto this year. I'm trying to get some funding to support it, but Bascom Palmer has asked us to develop a training program, a just-in-time online training program for all of their faculty and staff, their receptionists, their technicians, their surgeons, their post-op care, everyone who sees patients at Bascom Palmer. They've asked us to develop a training program for how to increase sensitivity and skills in working with children and adults with autism and intellectual and developmental disabilities who need vision care. That's a phenomenal opportunity for our center to jump in and help the #1 eye hospital in the United States be able to do something that's better. And we've got an opportunity coming up with that. Really excited about the things that are going on with our PATH clinic, our clinic for young adults with developmental disabilities. I think Shelley sent me a note the other day that we have about 60 patients that are now regularly using that service. And the only limitation that we have to it is staff and faculty and space. The growth is really there. I know there's been a lot of work this year to firm up our DASH curriculum for training for healthcare providers for working with people with intellectual and developmental disabilities who need hospital care. And there's opportunities to grow with that. Alan's conversation, Alan, I pushed the idea of training to think about being able to develop that with our technology to reach out to Central and South America. But to think about who do we target there, because in some of those countries, they don't have doctoral level providers. They may not even have master's level. In some cases, developmental services in some of the rural communities of Paraguay and Ecuador and others, it's volunteers in the community, it's parents who are providing the services. And so to be able to think about training models that can enhance our colleagues across the hemisphere are really there. We've kind of reached the end of the time. I wanted to wrap those up. I always throw those things out just to kind of make you go, oh my gosh, what's he thinking about now? I do want to say how deeply I appreciate each one of you, and how we don't get to say this to our staff very often. But I look at our staff, each of you, no matter what job you do, in what program you're in, you play a crucial role in all of the high-level success that we get to talk about for the Mailman Center. Lyndon Johnson, when he was president, you may have heard the story, once visited NASA. And as he was walking through, he saw an environmental services worker mopping the floor. And he stopped and he asked the gentleman, "What is it you do here at NASA?" And he replied, "I help put people on the moon." Each of us has that kind of role in the Mailman Center. Whether you are an assistant, you do scheduling, you verify insurance, you balance the books on grants, You help to clean the floors. You are all contributing directly to the benefit of the more than 15,000 children that we serve directly, and the many, many more children who benefit from the ideas that we are able to disseminate to community partners who replicate what we're doing here at the center. It is a phenomenal opportunity. I'm so very proud to be part of it. Our children over at the Debbie School giving you the U, they're really thankful. The parents in our community are as well. Thanks for joining us today for this hour. The ideas are good. Fire them along. I think that all of you know at this point, I am in no way a person that is formal that you can't reach out to. And I've been here now, February 1st was 25 years as director of the Mailman Center. And I don't think in the 25 years I've ever bitten anybody. So we're in pretty good shape there. Please reach out, share your ideas. And thank you for being part of this wonderful place that we've all been privileged to be part of. Have a great weekend.
Thank you.